1 in every 1,000 infants are affected by permanent hearing loss. 1% of children under 18 use hearing aids to treat hearing loss. So why is it so difficult for them to access these hearing aids? This has been a lifelong question for Canessa Mullins, a stunt actress with hearing loss as a result of being born premature. Growing up with hearing loss in theater was a challenge for her, especially when she lost access to her hearing aids at 12 years old. When Mullins' hearing aids broke in middle school, her parents' insurance company refused to cover the cost to replace them. With the average cost of hearing aids being between $2,000 and $8,000, Mullins' family couldn't afford to replace them at the time. So, she went 5 years without them.
But we couldn't get with our general health insurance for like 6 years to cover any kind of a hearing aid. And we couldn't get help from the school to buy a hearing aid or for anything to help me with my hearing loss. Most of the time my parents were just kind of told, sit her in the front of the classroom. She can just sit in the front of the classroom and make sure the teacher enunciates her words, which is so fun when all of your teachers are female and you lost your high register.
Mullins' insurance provider, along with many others in America, deem hearing aids as non-essential devices. Except for stunt actors like Mullins, it's extremely important that she can hear verbal cues for her performances. So, her hearing aids are essential to her safety and well-being at work. This is not an uncommon issue among the hard of hearing and deaf community. Dr. Catherine Alsup, an audiologist at the UNT Speech and Hearing Center, says that it's more common to see patients that can't afford their treatment than patients who can.
And when you identify the problem and then identify a solution, but you're not able to give the solution, then that's really frustrating. That's what I got into this field for, to be able to help people. And if I'm not able to help people for something as minor as, commercial insurance won't cover the cost, then that is overwhelmingly frustrating.
For the patients that can't get insurance to cover the cost of hearing aids, there are services and programs available that can help provide them. Some schools can provide hearing aids to students, but they're only able to use them while they're at school. Dr. Alsup also recommends that patients look into how the Texas Workforce Commission can help provide hearing aids for people that qualify. For the unfortunate few like Mullins that don't qualify for help, their last option is to save enough money to pay out of pocket. For NTTV, Tori Wells.